Correct. All right, good day, everyone. My name is Vishal Dugar. I am the Chief Growth Officer for Indus Technologies. Very excited to welcome you to yet another session of Digital Success Exchange. Now, this is a platform that INT has created where we invite eminent speakers from the industry to talk about things that matter. And today we have chosen a topic that I'm sure you will like, you will relate. And in this platform that we have had 50 plus video casts already with 2 million social impressions, 80,000 people involved. So a lot of good content that you would get here. Today's topic is, can pharma play the ONDC curveball? And I have with me Mr. Amaninder Dhillon. Amaninder has 20 plus years of experience, worked at senior levels at a lot of big pharma companies like GSK, Dr. Reddy's, Pfizer, AstraZeneca, and so on. Welcome, Amaninder. Glad to have you here.
Thanks, Vishal. Thanks for the invite and kind introduction. A pleasure to be connected.
Fantastic. So, if you look at the pharma value chain, there are a lot of things starting from drug discovery to preclinical trial, clinical trials, to manufacturing operations, sales and marketing. Then we have the stocks, right, the supply chain distribution, etc. So for today, we would focus on sales and marketing and supply chain distribution, right? The second point is we are talking about ONDC, which is Open Network for Digital Commerce. So more on the digital commerce side, retail side, but hey, industries learn from each other. So let's see what we can have, because ONDC, what it's doing in the retail world is fantastic, right? It's bringing in democratization of e-commerce, decentralization of e-commerce, uh, helping the sellers uh, earn more, be more discoverable, be the system is more transparent. And by the way, ONDC is not an application, it's not a software, it's not an intermediary also, it's a set of specifications supported by government that helps create an open network. So we'll talk about how pharma can leverage this idea and how it can also benefit. So to start with, Amrinder, talk about the opportunities in pharma industry, because it's a big industry in India now, $30 billion plus industry. Uh, India has highest number of sites approved by FDA, next only to USA, right? So a lot of opportunity. I would like to hear your views on that.
Thanks. Yeah, it's and these opportunities have been catapulted by COVID. Thanks to COVID and digital, which was thought to be a game changer. People are
Mhm.
slowly adapting it. Suddenly it has now become a necessity and no longer an option. And when you call of digital, it is data, and data is an evidence. Now everything is now started revolving about around that evidence. So it's the evidence-based marketing, and then since we go into personalization and individualization of approaches, which is happening in it. So if you
Mhm.
look at even the customers, physicians nowadays, they anticipate now that the scientific content which comes to them or a brand promotion is very interactive, intuitive, in a very summary format, in a crisp format, which comes from a credible source, and which they can, have it at their own convenience in real time. So something like Netflix, like an experience. If I've liked something, I should see more of it. So more of
Mhm.
iteration which is there. So the entire marketing is going through a change where it was more of a push, where the rep is going and asking for a demand. It's like, and digital is more of a pull based approach which is there. Now, getting into the pull based approach, it gives off opportunities for analytics. When you have data, you have analysis, so you have opportunity to now find out what the doctors are, you know, reading, what they are liking it. So you can develop some perceptual maps, from the social listenings, the social networks, social footprints is there, and all those inputs now can get triangulated with your face-to-face interaction. So you have a mirror, you can say a digital mirror, to also look into it for your customer and see what is his preferences are. And that's the
Mhm.
reason probably now you see, most of the pharma companies are actually getting into analytical mode. There's so much of, new jobs which are coming up, data analyst, and because there is a need to, now get that data into a nice visualized dashboard, because otherwise it's a raw data and it's
Mhm.
available inside of so many. So how do you bring that data, which is from integration from the field, which they are putting it in their CRM, the medical device, the medical affairs people, what they are putting into it. You've got a key accounts people are doing, and come up with a universal, source of truth. Where people can look into it and say what exactly is happening into it. So this is a change. More and more data which is going to come into it. You require more of such kind of data analytics coming into it, and I'm sure post going further you will start using those data to find out some patterns and trends with the help of artificial intelligence and machine learning, which will then guide the rep for the next best action.
Mhm.
So, you already have so much of happening in chat GPT, where you like it, you type it, and, it gives you a script, So I'm sure there's going to be, a little similar version where a rep is going to say, hey, I'm going to meet this doctor, and, what should I do? And then there is a list of prompts which comes to them, through an artificial intelligence, which has been analyzed at the back end by, algorithms for the data which has been fed into it. And
Mhm.
I think that's how it's the strategic alignment and new policies and promotion things will go up. So that's at the marketing side into it. But at a similar time, if you look at it, what's happening at the patients, the end users which are there, and India is privileged that due to cheaper smartphones, I think we have the maximum number of mobile users. A
Mhm.
recent survey said that we have around 78 million mobile user base is there, and average time spent is around 5 to 6 hours. So
Yeah.
that is an immense opportunity when it comes to digital, and I'm sure it's going to get even more better with 5G connectivity, which is getting rolled up into it.
Mhm.
Patients also, if you look at, they are looking into for some kind of a smart sensors or real-time analytics of their data monitoring with their Fitbit and smartphones, which are coming into it. So the entire mind shift changes now towards prevention and wellness,
Mhm.
and that's exactly changing the approach of the entire pharma industry also. So you have preventive wellness approach, self-diagnosis kit we have seen during the COVID times. Self-medication is on the rise because you have Dr. Google, thanks to it, and so
Mhm.
forth. It's going to get even smarter. And
Yeah.
at the same time, even because your new drugs are not getting discovered, because there is patent cliff, and many patents are going to get expired in next 3 4 years. So it brings opportunities for personalized or new drug delivery system, what you call into it. So
Mhm.
patches, self injectors, inhalers, subcutaneous injections, anything, self dissolving strips, nano based liposomal formulation, so which is more convenient, and it's more personal to apply it. You don't have to be dependent upon on someone. I think that is going to be a next big opportunities, like where the similar formulations are coming up into a different delivery systems.
Mhm.
And I think again, next opportunity which I see, which is parallelly happening, is your health records. So people do understand that, when you have the convenience of emails, nobody's writing emails, nobody's having those, papers to it. Why to hold your, health files, in that file folder? So why not
Mm-hmm.
it should be on the cloud? So the entire digitalization of the health records, the hospitals are becoming smarter, and
Mm-hmm.
so it opens up another plethora of opportunities where people are now started asking for value, because they see that data is a valuable thing because you can get insights. Similarly, now they are also looking into values when it comes to healthcare. And then
Mm-hmm.
there are opportunities which are being explored. People want medical concierge kind of a services. We have Pristine, which is doing some similar kind of services. People are also asking for financial planning assistance when it comes to healthcare because it's expensive, out of pocket. Even for filing for reimbursement, there are companies which are now helping in getting those filings done for insurance, because insurance is also getting liberalized.
Mm-hmm.
People want to analyze their own data. For example, if there is a ECG, I want to interpret it myself. I don't have to depend upon a doctor. So, there are agencies which are now trying to decipher that information in a very, very, layman, simpler language.
Mm-hmm.
What ECG means, what these PQRST means for you, because they would like to do that, and they want to empower themselves, in terms of their own health.
Right.
And you have those, even personalized health coaches and apps which are there for diabetes and so on and so forth. What are you
Mm-hmm.
eating, what are you exercising, and all that stuff. And then there's a teleconsultation. So there's a lot which is happening, a lot of opportunities which are happening at sales, marketing, and so for the entire gamut which you just said, from drug discovery. But
Mm-hmm.
let's keep our focus on sales and the marketing part of it. Now that brings to the supply chain or distribution. So
Mm-hmm.
if your two P's, or conventionally what four P's are there. So if your two P's are becoming digital, why not the distribution, which is your place of promotion, and distribution is a sub part of that lever, which is one of
Mm-hmm.
that. So you have that logistic intermediaries which have come in, which you want to build value in the supply chain.
Mm-hmm.
Now, when I say value in the supply chain, is that if you look at conventionally was you have a prescriber business, you have a key account business,
Mm-hmm.
but even now, if you go into the key accounts, there is so much of categorization which has happened into it. You have corporate chains, you have independent hospitals, you have governments which are there. Within government, you have railways, army, CGHS, ESA, which is categorizations. So you have institutes, ONGCs, which have a different pattern of purchase, and distribution. You have this Ayushman Bharat and Ayush Jan Aushadhi stores. The government has also become digitalized, so you have government GOE, which is digital bidding, online bidding when it comes to purchase. State has come very aggressively in terms of health, so they have become one more, you can say intermediaries when it comes to buying. They want to buy it and then distribute it. It's a political health has become a political vote bank also.
Mm-hmm.
So
Yeah.
states like Assam, Kerala, Rajasthan, they are way ahead. E-pharmacies have suddenly, you see that chemists have also started getting aggregated. So you have local chemists, you have made their own local app. I think, there was some news in the Gujarat, or for that matter, even auto, drivers in Bangalore, they had their own
Oh,
app to
yeah. Yeah.
fight with those Uber. And similarly, chemists have come their own app. Then there are those dispensing doctors, chemists in the rural areas. Subscription based healthcare is something which is again new thing which has come into it. Whereas it's a closed group between the insurance, and the healthcare providers, which could be
Mm-hmm.
doctors as well as the pharma medicines, where you subscribe to that particular insurance, and then it is a closed network. You only go to those particular hospitals, and then you get those particular medicines.
Mm-hmm.
So third party influences, like I said, insurances, disease specific, they have come up into. They have a cancer specific insurance, or non communicable diseases kind of insurances which are there. And then pharma does have direct to patients, where they could do patient support programs and healthcare and home and remote monitoring. So if you look at into it, there is layers of, in terms of distribution, in terms of markets, which is being created at every level, and which
Mm-hmm.
needs to be satisfied.
Mm-hmm. And
And
as you
each,
rightly said, with so many parties involved, there is so much of fragmentation, right? And if I again draw a parallel with the e-commerce side, the, in the e-commerce side, there were some big players, the likes of Amazon, Flipkart, GeoMarts, and so on, right? Similarly, on the pharma side, there are big distributors, stockists, sub-stockists, wholesale, retails, and so on. So in India, there are 55,000 plus stockists, for example, 550,000 plus pharmacists, right? There are so many challenges, and which is causing people to pay more, right? Let's take an example of inventory. On an average, Indian pharma industry has an inventory of approximately 230 plus days, right? Which is 98 days more than the best in class Indian industry players in pharma, which is another 16 days more from global industry players. And retail players, FMGC players, have a pharma of only 58 days. So imagine, from 58 days to 231 days, there's such a big gap. So people are losing, right? So that is why, as you said, the sellers would gain if there is an open network, the buyers would gain, the various players in logistics providers, for example, would gain. Also, it would reduce cost, it would democratize the whole system, it will bring in transparency, there would be less wastage, and so on. So how do you see now pharma adopting ONDC, and how will it benefit the whole industry?
yeah, so you rightly said that we have so much of fragmentation when it comes to only distribution, and then there are various categories of distribution. So they within that, there is a you have to subcategorize it, because every
Mm,
distributor will have his own priorities. So some
mhm.
would be more interested in train margins, some
Yeah,
would be interested in getting a quality product,
yeah,
some would be interested in getting service in time, you know and some would require financial support like credit extension.
correct.
So all these things, when you can service them based on, if you have a platform where they can be they can approach directly. There is no less intermediaries required,
Yeah,
because they have to choose the intermediary who's benefiting them.
exactly.
Is a distributor they have to go to a distributor who's going to give them credit extension, or they're going to go to a distributor who probably will give them better trade margins,
Mhm,
or you should go to a distributor where they feel that they will get a genuine quality products,
mhm. So
or
it gives
should
choices,
go
it
to,
gives choices to both sellers and buyers.
yeah, or should go to them to distributor who is committed in service. If he says that
Mhm,
he will get your products and by evening, he should get you by evening.
mhm,
And then imagine, because a chemist has to deal with so many different distributors, because there's so wide range of products which he has to do it. Imagine, how much time he is wasting. Because
mhm,
every distributor is going to send his delivery boy and order boy, and he has to have invoices coming in. And at the, after his closure of business hours, probably he has to feed in and get this reconciliation done. And
mhm.
that is why probably you see that within this distribution network, now there is a consolidation also happening. Now,
Yeah.
there are companies like Acnamed, which are only now focused on hospitals. They will
Mhm.
not supply to normal chemists. There
Yeah.
are now distributors which are only focused on rural marketing and B towns. There are
Mhm.
distributors now which are only focused on super specialty drugs. For example, IMS and Vardhaman. They only look into super specialty drugs, cold chain products, high value products, which are there. So even
Mhm.
then, within those distribution, there is a super specialization which is happening. And
Yeah.
if that can be made much more transparent and open, I
Mhm.
think that
Mhm.
brings a lot of you can say uh, removes redundancy and increases the your operational excellency.
Right.
At
Right.
the time, everybody wants that. We have, why do we have these digital tools? Because they help us to, these are all smart tools. Why do they're termed as smart tools? Because they help us to
Mhm.
get the work done smarter.
Absolutely, absolutely. And a lot of clients that INT works with, they come to us to ask for innovation, they come to us for speed, because technology is there, use cases are there, and we have the advantage of working with several players in the market. So they tell us that Vishal, how can INT help us solve a problem, bring together various parties, and create a solution for us? Also, what I see is for something like this, for having something like ONDC in pharma, right? There are a lot of things that are required. Government support is a must. Having support of public-minded company is important. Having innovative players who can fill the gaps that is coming. Is there a social need? So I would request you to talk a little about these three or four aspects from a pharma perspective. Is the market right for pharma to adopt ONDC kind of a setup?
I think yes. So the entire market is going through disruption. If you look at healthcare, and then it's not India. It's if in US, you see this cost plus drug company Mark Cuban, and
Mhm.
it's getting into people are getting into openness and transparency. He says, I'm this is my cost of manufacturing, and this is my percentage, and rest you can. This is I'm going to sell it to you.
Mhm.
So it becomes even more pertinent when it comes to a country like India, where most of your expenses are out of pocket. And
Mhm.
if you're a chronic disease patient, it goes for your life, which is there. Now, company and India is opening up, and if you look at this National Digital Health Mission, which is
Yeah.
NHA authorities, is in uh, an initiative which is for building trust and transparency. And the entire objective in terms of if government is giving so much of emphasis, and all that has happened post COVID, where health has suddenly become an
Yeah.
important thing, and the government wants, and other countries are looking towards India because the way COVID has was contained in such big population, and you were able to vaccinate so many people. That it's there that the countries are now looking for India as a health, you can say model. And
Mhm.
Heal in India is now again an initiative which is coming up by the government. The government first took the Global Innovation Summit. So you talked about the innovation which is there. So the government has taken that initiative step, and now they had that Prime Minister Modi last year, unveil this innovation in pharma because that's what
Mhm.
is required, which is there. And if you look at, there are initiatives now. Even I was going through the recent, report, especially with this G20 health agenda.
Mhm.
It's going to be showcased to the world that how India has been able to this Ayushman Bharat scheme, so one health
Mhm.
approach. So that's going to be one of you can say uh, Kohinoor of showcasing the Indians into other world. So
Right.
digitalization is there, which is happening, and that's actually going to open up, bring confidence that yes, similar kind of approach could be given to distribution also, because you
Mhm.
just can't have one arm digital. It has to be the entire chain ecosystem has to be there.
Correct.
And even if you look at the other way, government is trying to facilitate or encourage digital invoices, so e-prescription, the entire ecosystem is getting shaped up around transparency and digitalization. And I'm sure
Mhm.
that will really facilitate your distribution also, because uh, it you like I said, this is an enabler.
Mhm.
You can have and there are a lot of initiatives which the government has is taken or is in the process, like for example national drug database is being created.
Mhm.
Standardization of treatment specific guidelines has been there, which is
Yeah.
national cancer board is there. So fact sheets, health indexes is there, standardization of, so trade margins are there, in mandatory QR codes for 300 brands.
Mhm.
So so this kind of gives confidence to a third party support people, that yes, if they come up with an innovation which is in line, in sync with the umbrella of the ecosystem, it will be a success.
Right. And the good thing that I like about the Indian story here is that what we are doing is at a population scale, a billion plus people being benefited and a low cost solution. And you can talk about so many things. When we launched Aadhaar, right, the whole UPI that has come in, the way we did the COVID app, right now, what is happening to ONDC, all are large population scale solutions, right, that are coming up. From that context, how do you see ONDC helping, say, for example, the seller community in the pharma world?
Okay. So if you see, inherently there is a trust deficit also, when it comes to, and there's so and so forth, which is being taught, in the media, and off lately more with this Gambit,
Hmm.
tragedy which has happened, and the
Yeah.
media coverage, the truth pill. So there is a trust deficit which is there, which could be there. Secondly, if you look at in terms of, your the way the distribution or your procurement is being, the smaller pharmacies, they are losing out competition
Hmm.
because they don't have an access to better inventory.
Hmm.
They don't have the full range or the analytical tools, and your, prescription pattern of doctors keeps changing. The
Hmm.
number of new brands keep adding into it, so you don't know which brand you should stock and which brand you should not stock, and
Hmm.
you cannot, you know predict when will the demand of a particular, brand or molecule will come.
Hmm.
Now with so many intermediaries which are coming, which are trying to, digitize the chemists, or computerize the system, because it's very difficult for a one person to manage, the money transaction,
Hmm.
the inventory management, and, backend, and also
Hmm.
service the customer. So there are at least 10, 15 people, or, average 5 or 6 people you see at a chemist shop who will be
Hmm.
doing this. So if so these kind of, when you make a system which is transparent, you bring computerization into it, in your system, it becomes easy for the person in charge who is managing the pharmacy to find out how his inventory is moving, which molecules he has to order, when he should order, and how his, and if the number of players are less, it's become easy for him for reconciliation. Because if there are
Hmm.
expiries or breakages, he has to
Hmm.
run with, 10 different distributors from where the stocks had come, where is the invoice. So all that thing could, help these smaller, pharmacies.
Hmm.
Also, if you look at into it, there's a closed group marketing nexus also happens. There's a
Hmm.
doctor or physician, and the nearby chemists or hospitals, they will only keep those brands,
Yeah.
which are being, favorite to those, to that doctor. So if a person happens to come from a far off area, those brands will not be available to, chemists which are nearing his place of residence,
Hmm.
and they don't stock it because the demand has never come.
Correct.
So when they will be able to see this, particular brands open in a platform, the way we see, we do a shopping in Amazon, it's just, and there are so many filters which you can then apply and, narrow down your approach. It will become very
Hmm.
easy for a chemist, to, stock which is required, which is not required, who's the distributor,
Hmm.
and whom to order.
Hmm.
So there's a
Right.
one place, one source of, one window of transaction where a seller and a buyer are interacting. So that's what
Correct.
you can see on days ONDC is.
Correct. And let's talk a little bit more about the ONDC setup itself, right? So imagine today, uh, you have a few players in the retail world, the Amazons, the Flipkarts, and so on. Buyers have limited choices. Even sellers have limited choices where they can go and list their products. They have to pay more, they have to pay exorbitant prices to list on these things. They cannot choose, the buyers or the sellers cannot choose which distribution or which last mile connectivity player is doing this. Now, as soon as this open network comes into picture, any seller, any buyer, any seller can use his or her app. The buyer can use his or her app of choice. Similarly, the other players, the logistics players and so on, can use their choices. So it gives you so much of transparency and choices, right? So I'm going to talk a little about on the buyer side, right? How will such kind of a setup in pharma help the buyers also?
So if you look from the buyer's perspective into it, there is when you say distribution, the stocks are locked for so much of period of time. There's a value which is attached to it,
Mhm,
you know.
mhm.
And if you look the margins which are there, approximately 30% of the margins are locked in the intermediaries.
It is, yeah.
Yeah, because of the more number of hands get exchanged, the more you need to have that kind of a buffer for it.
Mhm,
And I was think that for most of the states, there are CFAs within the state, and what they're doing is they're shifting from CFA to within the same state, or to the
mhm,
same city, to a distributor, and then distributors again shifting it to a stockist, and
mhm,
sub
mhm,
stockist and to the chemist.
mhm.
So what is happening is this, the stocks are more on the road than on the shelf.
Yeah.
Yeah. So why not, if all these CFAs they can aggregate,
Mhm,
and most of the times the one CFA is a CFA for 3 4 companies, who manage the entire range of
mhm,
those companies which is there. So similarly, if there are people in the state, all the CFAs, they make a kind of a setup, uh, and they put their listing onto a buyer's side. It
mhm,
becomes very sorry, a seller's side. It becomes very easy for a buyer then to just log into that particular one and see what exactly where he wants it.
mhm,
Also, the number of logistics player which is going to pick up the stuff will become decrease substantially, because one big logistic person will take all those orders and it will distribute while it goes particular way of the way normally which your all Amazons or these e-cart kind of they have they they the artificially the or smartly there are tools which help them okay, this is the order, this is the path which you should go, and you should distribute it. By the end of the day you will be able to distribute to all the things.
mhm,
So it becomes your planning, your operational efficiency, all those things improves a lot, and that
mhm,
margin could be then used as a leverage for a competitiveness, or it could
mhm.
help the end benefit the your patients, because
Right.
why pay 30 35% to the intermediaries when that can same be passed to your end users who are, and then your prescriber physicians, they will be happy because their patients are getting benefited.
Mhm. Yeah. And you talked about one of the points earlier about counterfeits, for example, and quality and regulatory issue is a big issue in Indian pharma industry. Even we have seen a lot of pushback from, say, US FDA. Also, there have been a lot of checks and reports and issues being raised. So, do you think ONDC in pharma would help in resolving this issue of counterfeits and resolving the issue of quality and regulatory compliance for the pharma companies also?
Yeah, sure, why not? So because you're directly taking it from the manufacturer, and secondly, it's not on the both the things that quality is maintained, and especially for those biologics where you require cold chain, so there is less temperature excursion which can happen.
Mhm.
Otherwise it's you don't know, because most of the times the companies insure till the CFA, but what
Yeah,
happens at distribution and what happens at chemist level, they don't have that visibility.
correct.
And a small temperature excursion can mean a lot in terms of the outcome of the product. So here,
Hmm.
at least there is sure that yes, the product is there. It's gone through logistic, who has well maintained cold chain, and it is there.
Hmm.
Then in terms of recall, it's very easy. You get a visibility which is there where that has gone. Thirdly, in terms of your secondary analysis, you
Hmm.
get real time and geotag that okay, this sale is coming from this particular geographical area. So
Hmm.
otherwise, what is happening is that how does the company say okay, this distribution of a particular state is selling, so hence my sale is happening. But where is he selling? They don't have the visibility.
Hmm.
So now, when you are supplying directly to the end user or the chemist, to the hospitals, you
Hmm.
exactly know that how much sale is coming. You're not dependent upon your distributor to tell you what is the secondary sales happening, and whether your sales and marketing effort of your field colleagues is commensurate with that or not.
Hmm.
Because at this moment, you only see okay, this particular number has been achieved, whether it is coming from hospital A, B, C, D. It is not of importance, or it is left to the local intelligence of that rep to see where things are happening, or for that matter, whatever the information a distributor is giving to him is
Mm-hmm.
he consider it as as an intelligence and belief. But when you're
Right.
supplying it, it becomes, and for them also, they are not maintaining heavy inventories. They know, okay, they might work with only 3 or 4 days of inventory,
Yeah.
because there is one single window where they are ordering, and they know exactly whom to follow it up if there is a delay.
Mm-hmm. Right. And if you look at it, the another, well, I would say an opportunity that is becoming a challenge is product proliferation, right? Indian pharma companies are creating almost 15 to 30 products every year now, right? So with so much of action happening, India is becoming the generics capital of the world. Out of the $350 billion market of generics, India might have, say, 15 plus percentage share of that market, right? So this point about product proliferation, right, and growth in Indian pharma industry, how would that be taken care of when something like ONDC is implemented in pharma?
Obviously, when you have you have multiple brands to choose for, and
Mm-hmm.
you have that visibility also in front of you. Right now, many times the chemist may not have the visibility of the entire spread of available brands to him,
Mm-hmm.
so they can then choose, and based on that, those brands which are you can say fast moving, or the ones which are uh, more you can say preferred, they will, and they can also have a a loyalty attached to it. So
Mm-hmm.
when you know that this one customer is going to buy in bulk, and you have this entire his transaction history which is there, so there is a chances of getting into some kind of a gratification, loyalty, bonus. All those things could be given to that particular client.
Mm-hmm.
Otherwise,
Right.
it is in piecemeals. You want to increase sales, so you give some kind of trade discount. But here you are actually trying to ring fence and build loyalty of customers.
Mm-hmm. Mm-hmm.
So all that can help in building your brand exercise right now, and differentiate yourself from others.
Right, right. And if we look at some of the other sectors in the process value chain, right? Raw material and packaging suppliers, right? Because we talked of the extreme right in the process, but even before manufacturing, do you think there's scope of ONDC in for raw material and packaging supplier manufacturers also?
Yes, why not? It's a platform, so you can use it both for your end user product, and also for procuring your APIs.
Mm-hmm. Okay.
Yeah.
And so we heard a lot of good things about what ONDC can offer to pharma. What are the challenges that you see? Why has the government not picked this up, right? Maybe they are doing it slowly, first with e-commerce, then comes other sectors and so on. But what can be the challenges of adopting ONDC for pharma?
Well, I feel the current challenge is that, because there's so many of SKUs which are there, sub SKUs, like for example, the
Mm-hmm.
transaction would be of a level which I think they want to test it in with retail before they actually bring it, because you have a 100 milligram tablet, you have 250 milligram tablet, you have 500 milligram tablet. So number of SKUs goes up, and then
Mm-hmm.
how much you are able to bill it. The smallest unit has to be tagged for billing.
Mm-hmm.
So somebody may require only 2 strips. So
Mm-hmm.
when a distributor buys, they always buy in bulk. But when you give
Right.
an opportunity, open up an opportunity of, so there, then people will only buy, and you also give facilitating them with your all this computerized and analytic method. Is that I only require 2 strips. Why should I order for 2 boxes?
Yeah.
So
Yeah.
that kind of a number of transactions will increase, but at the same time, you will have a single invoice, so there a reconciliation become very much easier.
Mm-hmm.
So
Okay.
your accounting, your filing of will become much easier. So you will have a some kind of a trade off where you will the benefit.
Mhm. Makes sense. So we have some questions from our audiences also. Let's look at that. So Akash Nag asks, my question is for Mr. Dhillon. How do you think the acceptability of ONDC as the next digital step in pharma supply chain will look like? Do you suggest more awareness or value realization?
I think it will be value realization, and once people start getting value into it, others will get aware that okay, yes, there is this value which is there in adopting to this.
Mhm,
It might start with small test phase. You may not open up it, like I said. It may start with only servicing to big accounts like
mhm,
hospitals,
mhm,
or to with it may start with high end oncology drugs which are you can save some intermediate cost and direct to patient, which could be supplied, or for chronic diseases which is there. So it might become from there, that point, and then slowly it may get adopt into mass general thing. Another thing which is I can see is that now with intermediaries like which are now focused exclusively on particular market. For example, you have GoAptive, which goes into rural marketing. You have
mhm,
Bidano, which is into different. So you have and someone into super specialty business. So they will also, I think, will be the next adoption where they will start thinking of buying through directly through the purchasers, and
mhm.
doing it. And like I said, the ecosystem, once the insurance picks up, they will
Yeah.
definitely require everything in a documented manner. Your
Mhm,
paper bills may find it very difficult. So when you're filing it, people may ask, okay, you just scan it and send it, and people then, if you don't have your digital documents with you, it will become very cumbersome to scan all the documents and send it to it.
mhm.
So the way it will evolve is that it might not be the front end, but it will not be that laggard also in terms of adoption.
Right, right. And as you said, it reminds me of an anecdote. So once I was teaching my daughter, and I was asking true or false, and I said, say, tell me true or false. Technology cannot, and she said false. I said, please listen to my question. She said, oh, technology can do anything, right? So if you say technology cannot, the answer is definitely false, right? So it's good to see the next generation's interest and conviction in technology. I hope we are able to adopt it fast. Now, technology is there, but are we ready? That's the question, right? Is the industry ready? Uh, Also, we have another question from Sumantra Sarthi Haldar. What steps do you think should be taken to prevent product damage or potential harm to patient health or safety when it is transported by numerous forwarding agents, right? I think this is one of the things probably that ONDC in pharma will solve. But Mr. Dillon, happy to hear from you.
Yeah. So when I said, you will have the logistic partners which will have those capabilities, because they will ensure, because if they lose a big business, when
Mhm.
it comes, because they are catering to bigger accounts. So the logistic partners would build up their capabilities where they will ensure that minimum product damage happens. They have a separate containers for cold chain. They have separate containers for this thing. And for that matter, if you see, it's a personal experience. Big basket.
Mhm.
I regularly purchase, and then when they come, you see that they have a separate container for milk products. They have a separate container for when it comes to butter and cheese, which are cold chains. And hardly I've seen they miss an order, or if there is and the best part is, if they miss an order, they just try to give you some kind of a discount, or you
Mhm.
get a in fact also you get alert if the order which you have placed is was not there. Now suddenly that inventory has filled up. So all
Correct.
these things are, it's just a matter of getting used to it. And
Correct.
now I don't know, when was the last time probably we went to a a general store to buy these groceries.
Yeah, yeah. And that was one of the points. For something like this to be successful, there has to be an ecosystem of uh, innovators, right, who create around this service, and only then do we get the maximum value, Right. I have a question from Mr. Teja A. How many years is it required for ONDC to make it big? Right. I have some opinion on that. See, uh, Aadhaar, when it was done, it took probably 10 years for this scale, right? UPI was done in 5 years. ONDC, they are targeting in 2 years for retail. So our government, our companies, our India has learned by doing such things on a regular basis, and hopefully it comes faster. Look at how fast we implemented COVID, for example, right? So, I mean, that what do you think?
And I think the difficult part of getting you can say digital mindset has already been there. No? So you have this UPI which has gone to the panwalas and to golgappa walas, which is there. So people have accepted digital. So one that is a one good thing, which is a challenge which probably many Western countries have yet not been able to move ahead of credit card or debit cards. They still
Mhm.
can't believe that you can do without them also, you
Yeah.
know so that is one good thing which has happened. COVID has given the government the confidence that yes, such thing can happen at scale.
Mhm.
And also, if you look at it, more or less the generations which are coming generations, I don't see they will even go to a bank, or they will actually see a virtual physical bank. Everything is happening digitally. It's e-commerce which is there. So people and Indians are adoptive. We are, I think,
Mhm.
much faster adoptive when it comes to new things.
Mhm.
So I don't see that, and it as a challenge. There would be some issues. There will be some, people they might, like a fraud or financially, people might, and it happens. But then the best thing about digital is that they all leave footprints. So
Mhm.
even if something has happened, there's a slip or somebody has happened, you can backtrace it, which is not possible in fear in physical world, where people tear off those bills and invoices, and then where it came, who took it. And that is the reason why all this adulteration, counterfeit thing happens. It is a mixing which is there.
Correct.
Once the system is transparent, you will find that this kind of things will not happen, because you
Correct.
can always find, and it's like a blockchain technology, you will always be able to trace it back, the source from where it happened. It
Right.
may take a while, but you will definitely get that.
Right. And people like it, right? The end consumer, I always say you have to look at your client's client benefit that is happening. So for digital success provider companies like INT, if I am working for a pharma company and I am creating a project for them, yeah, that's good. But if my people do not know how does it help the pharma company's customers, right? Until that time we would not know. So I think ONDC would do a lot of that, that how is the end customer benefiting from this. And as I said earlier, not just on the buyer side but seller side also, there are so many small sellers who can make big but who are having a problem because of the cost barriers that the big players are bringing, right? So that will definitely help when ONDC kind of a setup comes in pharma, right? So Mr. Dillon, also how do we look at the next steps like ONDC as the government is implementing? It is taking baby steps, right? It is rolling it out into some cities, some big, some small, some rural areas. It is trying with a few buyer apps first, then the seller apps, then more and more, right? uh, what steps would you suggest government to start with in adopting ONDC in pharma, and what can be the journey?
I think the first thing which government has already done is to get those QR codes, onto few brands, and I think
Mhm.
that will initiate the process of transparency, because people will be able, once they know that they can backtrack that the
Mhm.
source of this particular medicine which I'm taking, not only to who has manufactured it, but who was, from where did the API came into it for this manufacturing. So it's not,
Mhm.
I want to know only the manufacturer's name, but I also
Right.
want to know the from manufacturer purchased this API from whom. you know.
Mhm,
So
mhm,
I think that is the first step where, you're trying to build in a confidence level, with
mhm,
your client, like you said, the clients kind of a thing. So,
mhm, mhm,
and once that is established, because to do that, they have to make changes in their own manufacturing ERP, because
mhm,
each batch has to be then, digitized and documented. Now once you
mhm,
have done that, it's just a matter of somebody coming and then linking it with your billing system, and then the same thing get integrated with your distribution system. So it
mhm,
starts from the manufacturing, where you're doing everything, digitizing your, making a records of each batch which is being manufactured. So that
mhm,
was the first step. So once you have that digital, you know f- ID generated for a
mhm,
particular strip, or for a particular, or the single unit which is there, it's
mhm,
easy then to integrate it with your, billing and distribution system.
mhm. Yeah.
And if you can do it for 300 brands, why stop it? You better, whichever
Yeah.
brand you are doing it, because you won't make your line only for those particular brands. So your manufacturing will be for the entire other brands also, which might not be on the list. So I think it starts from there. The challenge was, like, the way you have a challenge of coming up with the Aadhaar card. Once you had
Mhm,
an Aadhaar card, you link it with the COVID. It became so
mhm.
easy. Now, if you
Yeah.
have a COVID, you link it with your Aadhaar account. It becomes
Mhm.
easier. So
Yeah.
that is all I think. I see a journey of ONDC happening
Mhm.
going forward.
Right. Right. And who should be afraid of ONDC in pharma? Are there any players? Is it a zero-sum game? Is there space for everybody to grow in this? What's your view?
Well, I think there will be apprehensions, because you have this chain of distributions which are there, and they have their own local network, and you can
Yeah.
say areas marked for themselves.
Mhm,
So that will go away, but
mhm.
it may not. It might happen that they have to shift to maybe smaller towns,
Yeah.
or to remote rural areas. But it doesn't make any sense, in place like Delhi or Bangalore, where you have this Blinkit and Dunzo, which can ship goods from one place to another in 30 minutes. Why do your CFA has to send it to a distributor, and distributor has to keep it with him in his own warehouse, then give it to a sub distributor, and to a stockist, and then to a chemist? you know, so I think in bigger towns, it will be a faster adoption.
Mhm.
And
Okay.
probably the way things are moving, it will move towards the conventional systems will start moving towards rural and semi-urban areas.
Mhm. Right. Right. So good news. Nobody should be afraid of this. Yes, the bigger monopolies will break, but it will, if they adopt these technologies, because similar to ONDC, when we talk about, hey, will can Flipkart also log into ONDC? Yes, they can. Can Amazon also do it? Yes, they can. So even the bigger players who are there, who have monopolies, it's good for them if they log into ONDC and enhance the service levels. They might not lose their business. In fact, they can grow also. But what it does is it makes the market bigger. And India is just touching the tip of the iceberg, right? There's so much to do, right? We can capture such a large part of the pharmaceutical industry altogether. I think there is scope for everybody to grow leveraging ONDC.
Yeah, we are 1/7 of the world population, so
Mm-hmm.
it's a big market to open up. And
Right.
why keep it in silos? In fact, everybody, if you look at it, companies are not, they feel that there is uh, operational inefficiencies working in silos, so they are breaking those silos. There are open
Mm-hmm.
offices which are there are smart factories which are coming into it.
Mm-hmm.
Internet of thing is coming into it. You keep a tab of each and everything which is on which is connected to your on the internet. So I think more the transparency is that it will increase, widen the base. So if you
Correct.
look at banking, it has become digitalized. Has it
Mhm.
contained the banking industry? No, banking industry has grown after digitalization only.
Yeah, yeah. And why just banking? If you look at insurance industry also, right? The kind of digitization that is coming there, the with the base, as as you said, 1/7 of the population of the world, but how much has been covered by insurance, right? So there's a lot to do. Similarly, banking, there are so many unbanked folks, lot to do. Digital commerce has not reached to a lot of people. That will help. Similarly, pharmaceuticals, while people are getting medicines and so on, but are they getting it faster? Can it also mean that it saved life of people because they got the medicine faster, right? They got the medicine cheaper. So I think a lot of positiveness around ONDC adoption in pharma, right? And with that positive note, I would like to conclude this session that we have. So folks, stay tuned for ONDC in pharma. A lot of innovation has to come, a lot of transparency, a lot of cost reduction, and ultimately benefiting each of us. Thank you, Amarinder, for your wise words and all your uh, uh, beautiful concepts and what you have thought about this topic. Thank you so much and wish you a good day.
Pleasure to be connected. And it's always, if there are questions post this live session, I'll be happy to answer those questions. So, real pleasure,
Absolutely.
Vishal.
Thank you so much. Have a good day. Bye bye, all. Take care.
Bye bye. Bye.